This conference will now be recorded.
Good morning, everyone. Welcome to Whatcom Unified Command and Whatcom County Health Department's media briefing for Tuesday, August 18th. I'm Melissa Morin, Public Information Officer with the Whatcom County Health Department. Today, we're going to be hearing updates about our county's response to COVID-19 from Erica Lattenbach, Whatcom County Health Department Director, and Scott McCreary, Incident Commander with Whatcom Unified Command. As we get started, I just want to remind you that this meeting is being recorded and it will be available later this afternoon on Whatcom County Government's YouTube channel and on the media page at www.whatcomcounty.us/COVID. After we hear from our speakers, we'll open up the chat feature and invite members of the media to ask questions at that point. Thanks everyone for being here today, and I will now turn it over to Erica.
Thanks, Melissa. Good morning, everyone. I want to start by just giving an overall picture of what we're seeing and potentially some reasons why we're seeing what we're seeing, and then provide a bit more information about some of the things that the Whatcom County Health Department is doing specifically to work with different populations to reduce the spread of the virus. And then I'll turn it over to Scott to talk about our testing project in collaboration with Whatcom Unified. So what we are seeing and what many of you have likely noticed as you watch our case counts is our rates have decreased in the last 2 weeks to the point where we have seen only 1 or 2 days in the last couple of weeks that we had a daily case count of more than 10, which is quite a bit lower than what we've seen earlier in the summer and post-advent of phase 2 being implemented. We are seeing more recently more cases among children under 18. We continue to see disparities in cases among our Alaska Native American Indian population and among our Hispanic population, Latinx population in Whatcom County. We are seeing good trends in addition to the case counts. We have one person at our Byron Street facility, our isolation and quarantine facility, and our census has remained fairly low for the last couple of weeks there as well. And only 0.4% of licensed beds are occupied by COVID patients at Peace Health. So our case rates are low. Our utilization of our hospital systems, so in indication of severe illness, continues to be low, and our use of our isolation and quarantine facility is low as well in the last couple of weeks. We, in fact, have lower rates, significantly lower rates than the state average. The state average is 109.9 per 100,000. And Whatcom County is currently sitting at 47.9 per 100,000. We actually have lower rates than almost anywhere in the state. There are only 7 counties that have lower rates than Whatcom County, and those are small counties, population-wise: San Juan, Columbia, Garfield, Skamania, Jefferson Island, and Pacific counties all have lower rates than Whatcom, but we are sitting very low in terms of disease burden that we've been able to detect. And we will have more information about why that might be. There are lots of questions still. It's very hard to be able to pinpoint exactly why our case rates are low. And we recognize that there's a few driving factors that are likely the cause, but we can't determine decisively which factors, given the complexity of this disease, which factors are determining to be absolutely linked to the lowering case rates. We have seen fewer large outbreaks among our population. We have seen an increased uptick in mask use and in social distancing and physical distancing measures. We, about a month and a half ago, I believe, had researchers that preliminarily determined that about 46% of people who are wearing masks in Whatcom County. We don't know what that current number is, but we're working to get some sort of rough estimate, or at least some estimates that could help us determine whether or not the mask mandate statewide has had the intended effect, and if it has had the intended effect in Whatcom County. We also know that our case and contact investigations and our isolation and quarantine work has played a contributing factor in the lower case rates. We are seeing that that more than a third of the new cases were already in our system, whether they were identified as close contacts of cases, or there was a definitive epilink between the cases and these new cases. So that indicates that we, at least to a certain extent, have a handle on the spread of disease within the county. That said, there are still many new cases that are popping up that we don't have a clear epilink for, which means that there may be a number of people who are asymptomatic that are spreading the disease, and we're able to pick up via those contacts, but not through the initial case, because people that are asymptomatic are not being tested potentially at the same rates as people who have symptoms. So that work is helping, and the sort of collective effort of the health department and Whatcom Unified is having an impact. And from the health department perspective, we work with lots of different key groups. We have a business response team, we have a school team, we have a long-term care team, and a quarantine and isolation response team. We have a vulnerable populations team, and a nurse consult team that work directly with individuals. So we are really working very hard to try to tackle all of the various high-risk populations or potential areas for spread within our community, and have had success with that in working with businesses and long-term care facilities, schools, etc., and working really collaboratively with them. And we are finding that through testing and through rapid results, we're able to make contact very quickly with new cases and with their contacts, and be able to provide them with education about how to effectively isolate or quarantine, which we also know makes a difference in the spread of the disease. The sooner a person knows their test result, and that they could be an exposure risk for others and are able to isolate or quarantine, that helps reduce the spread of the disease. All of these factors play into our case rates, but that said, because this is a global pandemic, it's complicated. We are learning more every day and every week. We are not out of the woods yet. We could see from, as we've talked about, one single large event could cause another spike in cases. From the health department perspective, we're doing all of the things that we're able to do in order to keep the case rates low, but we still rely on our residents and our community social behaviors, preventive practices like wearing masks, and other measures that can help prevent the spread of the disease, which is just as important as once we get that case coming in. So the preventive measures are incredibly important, and we're very reliant on the community to be continuing those practices when at all possible. So with that said, we will give, I just want to let you know that we do plan to have another media briefing next week. And at that briefing, we will bring in some staff who specialize in some of these different areas to give you a little more detail about our process and how our nurses and other professionals work with community members and with organizations to help prevent the spread of disease. We'll also have more information and data about what we're seeing next week, to be determined on which day and time. But next week we do plan to have another media briefing. So with that, I'll turn it over to Scott to talk about our our collaborative testing initiative and how that's going so far. And happy to answer questions following his remarks.
Thanks, Erica. And let me stress that our testing effort is, as Erica mentioned, collaborative. We've had a great partnership with the Whatcom County Health Department, as well as a number of community partners to bring this to fruition. We continue to put the testing process in place, and I'll provide some detail on kind of where we are with that and the process that we've undertaken. You'll recall that back in July, we established a drive-through testing pilot program at Civic Field. That was pretty successful. We were able to test over 1,800 community members over the 2 weekends that we did that testing, but we found it to be very personnel intensive to the point of really being unsustainable. There were also some other costs associated with that really brought into question how long that kind of model could be sustained. So as a result of that, and as an effort to be a kind of learning organization and continuous improvement, we took the lessons that we learned from that pilot program and started looking at what we could do next to provide that same level of service, but in a more sustainable way. And that's the endeavor that we are undertaking right now, is a trial period for a new low barrier community-wide testing process. We've started trials with that last week. We continue this week to be in a trial mode, and our goal is to be able to go community-wide with that testing program, potentially as early as next week. But I am going to underscore that is potential. One of the things that we're learning this week is that where we've overcome some of the technological challenges, which we were initially concerned would be kind of the limiting factor in bringing this to the community. What we're finding now is it's actually getting the volunteers that we need to be able to staff the process that is, at this point, a limiting factor. So we've been doing testing here half days well, 5 days a week, half days in Bellingham at the Bellingham testing site, as I said last week, and then we're doing that again this week. This week, what we've been able to do is go live with the online scheduling component of that, allowing individuals to go to the testdirectly.com/Whatcom website, where they can access the available schedule, identify where there are testing slots available, at what times on which days, and then pre-register for testing. And that's really the key component of this second testing effort, is the efficiency that comes with having people pre-registered in the system. The pilot program we did at Civic Field back in July, we were registering people in real time. As a result of that, it took much more time per individual or per vehicle to register people. Sometimes if a vehicle had only one person, it was a matter of 5 minutes to register. But if a vehicle showed up with 5 people, sometimes it would be 20, 25 minutes just to get through the registration process. And given that there was no pre-registration available, people had to wait in line as long as 2 to 3 hours to be tested. With this pre-registration based system, people know when their scheduled appointment is. They can show up at the testing site at that time, and they're in and out in a matter of 5 to 10 minutes at the most. And that's been working pretty well. I will admit we ran into some backups yesterday, and we're still trying to understand what the challenges were there. But I was on site for a portion of that and can report out that the longest wait that I saw for anybody was 30 minutes. So significantly less than the 2 to 3 hours that it had previously taken. But as I mentioned, there are really two components to this. There's the technology component and then the personnel component. On the technology component, it's been a function of working with Test Directly and Northwest Laboratories to customize the software that's used for registering people, as well as reporting out test results to people, and customize that for our needs here in Whatcom County, and to be able to provide the low barrier testing that we are endeavoring to provide, which is testing for anyone, whether they have insurance or not, whether they have a primary care provider or not. So as with any software customization, there have been things to work through there, additional enhancements that we identified along the way. Boy, it would be great if it could do this. And our partners there at Test Directly have really done fantastic work, working very long days and over the weekends to try and deliver to us a stable platform in the time frame that we were asking for. Then there's the integration of that software with the hardware to work in remote locations, outside of an office environment, and then the procedures and processes that go along with that. I want to point out that while pre-registration is a very important component of this, really it's the crux of having this work efficiently for the community. There is a means of people being able to pre-register even if they don't have internet access. We have what we call test access schedulers who staff a phone line 7 days a week from 8 a.m. to 4:30 p.m., I believe it is. And anybody who doesn't have internet access and can't pre-register themselves, they can call into that test access scheduling line, and someone will either help them through problems, if they're having problems registering online, or if they, as I said, they don't have access to online registration, the folks there on those phones will actually register them and ensure that they have an appointment, and then provide them the information that they need for when they show up. Those are staffed by Whatcom Unified Command volunteers who have been trained and are being supervised by some of the staff there at the health department, which is where they're located, taking those calls. So again, just a great partnership between Whatcom Unified Command and the health department. Talked about this as community-wide testing. So I want to mention the locations where we expect to be able to provide testing throughout Whatcom County. We've committed to being able to do testing in each of the 7 school districts in Whatcom County. Of course, in Bellingham, in the Bellingham School District, that's been at that Champion Street parking lot area. In the Blaine School District, Birch Bay Bible Community Church has agreed to allow us to use their parking lot. In Ferndale, the testing will be at the parking lot of the Ferndale Events Center. In Linden, testing will be at Bender Fields. In the Meridian School District, it'll be at the Sikh Temple. In the Nooksack School District, it'll be at Christ Fellowship Church parking lot. And in the Mount Baker School District, it will be at the Nooksack Casino there in the parking lot. And I'll provide Melissa a list of all of these that she can share with you folks afterwards. I want to recognize the partners, the community partners that are making their facilities available to us. Again, some of the are faith-based partners, but some of them are private corporations and companies who are making their facility available to us to use, and we greatly appreciate that support. It really reflects the community-wide nature of our need here. But to speak to the community-wide nature of the need a little bit, I want to be clear that the challenge that we have right now, while we've worked through a lot of the technology issues, our challenge right now is the volunteer staffing to staff this process. We end up needing about 62 volunteers each week to make this system work. Now that's down from, and we call them volunteer shifts. So I want to be clear, each shift is about 4.5 hours long. So those are 62 separate volunteer shifts that we are trying to fill. That's in comparison to 328 shifts that it took to do the testing during the drive-through pilot at Civic Field over 4 days. So 62 shifts over 5 days versus 328 shifts over 4 days. So significantly lower personnel demand associated with this process. Again, it's the pre-registration that facilitates that efficiency. But we are challenged to get the volunteers to fulfill all of those 62 shifts each week. And in particular, it's licensed medical professionals, those who are able to actually do the swabbing, the sample collection. That's where we're running into our biggest challenge. We are working through the county health officer and with our community health provider organizations to try and address some of these challenges, but that is the limiting factor right now, is being able to have the appropriate number of licensed medical professionals to be able to do the sampling. I want to acknowledge the volunteer branch here at Whatcom Unified Command. Just a fantastic group of people who are reaching out to our 160 Whatcom Unified Command volunteers, the volunteers of the Medical Reserve Corps. And I want to also acknowledge all of those volunteers who are making themselves available and giving of their time and talents on behalf of the community. We've got just a fantastic community support for this, I think driven by the recognized need within the community for low barrier testing throughout Whatcom County, where we can make it easy for people to access testing no matter where they live in the county. But we continue to need that support, and will appreciate ongoing help from anybody who has time and talent to give. With that, Melissa, I think that that's my update on testing.
Great, thank you, Scott and Erica. The chat feature is open, so again, we'll invite members of the media. If you'd like to ask a question of our presenters today, go ahead and type your name and affiliation into the chat box, and we will take those questions as they come in. As Scott said, we will also have a list of those county-wide locations available for folks later today. And we have a list of the participants here, so we can reach out and get that out to folks directly who have participated in this call. And we will also be getting that information up on online shortly as well. And then just one other thing, as you ask your questions, if you can identify who your question is directed to, that will help us as well. Looks like our first question is from Key Ralia with the Bellingham Herald. Key, go ahead. Key, if you want to double check that you've got yourself unmuted, or if you'd like to type your question into the chat feature, I can go ahead and read that out as well. Okay, we'll come back to Key's question. Our next question is from David Rosbach with the Bellingham Herald. Dave, go ahead. It looks like we may be having some mic issues. We'll get our tech folks on that. In the meantime, I'll go ahead and read out Key's question. For Scott, how many licensed medical professionals do you need to swab? And are there any considerations about letting people self-swab?
Thanks for that question. We are trying to schedule 4 licensed medical professionals for each shift. That ends up being 40 shifts that we need to fill each 5-day testing week. I will say there are many of the medical professionals who are willing to commit to either multiple shifts in a day or multiple shifts in a week. So that doesn't necessarily translate into 40 separate individuals, but those are the number of shifts that we're trying to fill. With regard to self-swabbing, I can share what I know, but that may be something that Erica wants to address as well. The conversations I've had with the public health nurse who's heading up the medical side of this is that while that's certainly possible and can be done and is done in other locations, their experience has been that it actually takes more time for the medical professional to explain the self-swab process to the individual and have them do the self-swab, and that by using trained medical professionals to do that, increases the efficiency and allows us to test more people each day than if we went to self-swabbing.
The other consideration is the fidelity of the test and ensuring that the test is administered correctly and placed sterilely into the solution and the test kit, so we can ensure that the test is correct when it goes to Northwest Labs and there's no contamination. So that's the only other issue that I'll add. But the testing landscape is changing very rapidly, and it could be in the next month or two that there are, additional options like, I was just muted, I apologize. But there, as soon as the next month or two, there may be options for people to provide, to actually spit into a cup or other types of options that would reduce the reliance and need for medical professionals to be involved in the process. So we continue to track the technology and the changes and are working with Northwest Labs on different validation studies for new technologies. So we will continue to adapt as we need to, and hopefully the need for this level of medical professionals will be more short-term than long-term.
Thanks, Scott and Erica. So it does look like we're having a bit of trouble with our audio for folks who are participating. So if you do have a question, go ahead and type that into the chat and I'll continue to read out questions as they come in. Our next question is from Dave Rossbach with the Herald. Dave's question is for Erica. He's asking if Erica, if you can repeat some of the statistics about the recent decrease in new cases in the county.
I sure can. Let's see, what statistic? I believe, and this is all in the risk assessment dashboard as well, Whatcom County's current case per 100,000 is 47.9 versus the state's, which is 109.9. And there are only 7 counties, and I can type those into the chat box, 7 counties that have a lower case rate than Whatcom County at this point. And we have seen, I think, only 1 or potentially 2 days in the last 2 weeks where we had cases over 10, case rate over 10, or not case rate, excuse me, case count over 10. Did that answer your question? I probably rattled off some additional information that was not on my notes, so apologies for that. Okay, great.
Okay, our next question is from Tom Bonsi. Tom's question is for Erica. How accurate is it to describe the Point Roberts community as quote unquote COVID free? The fire chief in the isolated community regularly reminds us that extensive testing since April has not uncovered a single positive test.
What we have determined is there are no positive cases we have linked to. Well, there is one case from a Point Roberts resident, but we believe the exposure was after that individual entered a long-term care facility versus in Point Roberts. I will say that testing is one component, and I think, we talked about testing a lot today. Testing is one component of prevention. Testing alone doesn't equate to, it doesn't solve the problem. Testing does not solve this problem. The way that we solve this problem is through people physically isolating, wearing masks, getting tested, yes, but once they are tested, if they have a positive result, isolating for the period that's been determined based on their exposure time. Testing alone, if you don't do anything with that test or don't change your behavior or don't isolate or don't quarantine, does nothing to prevent the spread of this disease. So it is a continuum. It is a process that begins with prevention and ends with isolation and quarantine, but there are a lot of different components besides testing that go into this whole process. So I just want to clearly state that we do appreciate that there has been testing up in Point Roberts, but that alone has not resulted in 0 cases in Point Roberts. It's more likely the isolated nature of that community and the limited exposure they have.
Thanks, Erica. We'll hold the chat open just for a couple more minutes. If there are any additional questions, go ahead and type those into the chat feature. All right, it looks like that may be all of our questions today. We apologize for the audio issues. If there are any follow-up questions, you can certainly reach out to us. And we will go ahead and follow up on those at a later time. For now, we will go ahead and close this out. Thanks everyone for attending, and we will look forward to speaking with you again next week.